Welcome back. You're still watching The Globe. Now, technology has enabled remote working, learning and social connections during the COVID-19 pandemic. But there's increases of up to 80% in time spent in front of screens. And this has seen a rise in the attention deficit hyperactivity disorder. Symptoms such as a lack of focus, poor concentration and restlessness among both adults and children. The psychiatric disorder is seen as a concern whilst we observe National Attention Deficit Hyperactivity Disorder Day. ADHD is the most common psychiatric disorder in children, affecting approximately 1 in 20 children and follows about 65% of them into adulthood, affecting about 1 million adults in South Africa. Excessive screen time, either watching television or using devices, including laptops, mobile phones and tablets, negatively affect concentration, memory and learning and contributes to problems with sleep, obesity, depression and anxiety. Well, psychiatrist Professor Renata Schoeman, a convener of the ADHD Special Interest Group of the South African Society of Psychiatrists, said a number of studies in a number of countries, including China, India, Australia, Canada, the US and the UK, have pointed to excessive screen time during the pandemic associated with the worsening of ADHD symptoms. Well, for more on this, let's speak to Professor Renata Schoeman. She joins us now via Zoom. Thank you so much indeed for joining us and welcome to the program.
Good evening.
All right, so let's start with, a simple definition of ADHD, what it is and how it manifests. How do we see it? How does it express itself?
So ADHD is a neurodevelopmental disorder, and as you rightly mentioned, it's the most common psychiatric disorder amongst children. When we diagnose it, we do a thorough assessment and we look for symptoms in clusters of inattentiveness, hyperactivity and impulsivity. Now, these symptoms are not only there at a specific point in time, it has to be there across a patient's lifespan, and it has to be present in different settings, for example, at work or at school, but also in your private social life. And it can definitely, or should, before it's called a disorder, affect someone's functioning.
So do we know why and how this extra screen time is contributing to more of these kinds of symptoms associated with ADHD?
Yes, excessive screen time directly influences the neurobiology in the brain, the way that you secrete dopamine in the brain and how it's then functioning. And dopamine is one of that neurotransmitters which is extremely important to maintain your focus. And then another neurotransmitter that is important is noradrenaline, that helps us to prevent distractions or to be distracted by extraneous stimuli. Now, when we are browsing excessively on screen time, that's the one thing that's affected because our own natural dopamine then doesn't function. We get literally addicted to the changes that we see the whole time on our screen. But not only is it that, there's also excessive stimulation of certain of our brainwaves that then can cause secondary problems, for example, with your sleep. And if you don't sleep enough, you can also be more emotional the next day and also struggle more, what we call with task unrelated sorts that can present like ADHD. Furthermore, because we are more sedentary and we stay for excessive hours behind the screen in one position, we get less exercise. And once again, exercise is so crucial for our physical and our mental health and also for your concentration. So this is really a combination of factors which then leads to the rise of symptoms that looks exactly like ADHD.
I suppose this is also a consequence of modern living. Once we all got mobile phones, I don't know anybody who is still for a minute in a queue that doesn't take out their phone and add to that screen time and starts to do those things that you described. So is this become a disease of the 21st century?
We hope not. We hope that we can all learn to use technology for our benefit and not to our detriment. Unfortunately, some of the studies have shown that the average adult touches or look on their phone at least 1,700 times a day, and that we change applications on our computer, on our screen, up to 37 times an hour. That's almost once every minute that you interrupt yourself. And multitasking is a fallacy. It reduces your cognitive abilities with up to 20%. So it makes us much, much less efficient if we do not learn how to manage this and also be more responsible in our use of technology.
This last week, I did a story on the program, and it had to do with China trying to reduce screen time for their children because addiction was starting to set in. Is that something that we're seeing more and more of in South Africa?
Unfortunately, yes. So we do have what we call internet use disorder or excessive addiction to screen times as well. And not only is it the excessive time that we spend on screen and the addictive ability of that, but the other problem is the content and the contacts, especially in our younger population, our children and our adolescents. If you do not know what's going on the child's screen, they most likely or might unfortunately be involved in sites they shouldn't be, see content that they shouldn't, or even become connected with people that is to their mental detriment.
Is ADHD something that we're starting to understand more? Because it does sound quite new age. You know, when I was a kid, I don't think we ever used the word like that. You know, you just told pay attention or settle down. That was the talk of the day.
Yeah, unfortunately, even when I was younger, you know, people were just labeled as being naughty or stupid or lazy. But we understand more and more of the disorder. It's not new. The first time it was written up dates back to the 1700s, and even in the 1800s in Germany, it was described quite clearly. But the modern presentation of ADHD as we diagnose it only really became more to the fore around about 1930s, 1937. So it's almost 100 years with us. But as the stigma of all mental health disorders decrease and we understand the neurobiology and the changes in the brain and the functioning and the development of the brain better, people become more aware of the disorder and people are more inclined also to seek help for assessment and possible treatment.
It might be in some ways a little easier to observe changes in children, but what about adults? How do we sort through everything and say, do you know what, maybe I've got ADHD, let me go and get checked out?
Yeah, I think it's very important, and especially when adults present with symptoms, we always have to look, is it new onset or was it there since early childhood? Because for ADHD, it's a lifespan disorder. It's not something new. Now, in clinical practice, what we see, most of the patients or adults that present with ADHD-like symptoms actually have sleep deprivation or then excessive use of technology or multitasking. But also often in adults, there might be depression or anxiety or substance abuse that can be confused with ADHD. The other thing that is very important when we diagnose, it's really that we do get collateral information as far as possible, whether it's from a partner, a parent, a colleague at work, or whatever the case might be, to really have the full cluster of symptoms, not to overdiagnose as well.
All right, on a national day like this, what's the most important message you want to get across?
I think if you do recognize symptoms, either in your child or in yourself, especially now with working from home, with all the additional stresses that we have and all the additional role conflict that you might have and children having less structure, it's so important that if you notice the symptoms, that you do seek professional advice, either from a psychiatrist or psychologist or a pediatric neurologist for a full assessment. If we leave ADHD untreated, we really impede a child's development and we put them at high risk for the development of additional disorders such as anxiety, depression, or even substance abuse. And we also sit with a child with a poor self-esteem or an adult that's living a life with perpetual failure.
Is ADHD reversible, or is it just one of those things that we need to manage by not adding to the problem?
We definitely need to manage it, but it's never only medication. We also need discipline. We need lifestyle changes, we need therapy often, and we need skills how to deal more effectively with the symptoms. Now, it is not curable as such, but as the brain develops, there is a certain percentage of children that can outgrow the symptoms of ADHD or at least get better in managing it.
Yeah.
So if 5 out of 100 children have ADHD, we see roughly 3 out of 100 adults have ADHD. But medication can be life-changing in the instances where medication is indicated. And we should start to speak and see this invisible mental health disorders as biological disorders, like we approach diabetes or hypertension.
So what are the positive things that we can do? Is it spending less time in front of screens, actually talking to people instead of WhatsApping them, going out for walks, looking at trees and the sky? What should we be doing?
I think it's so important that we do get up and move. And it's a good rule to say that every 45 minutes, I need to take a break for 5 minutes from my screen, or every 90 minutes for 15 minutes, a break from my screen. The other thing is to make sure that at least 30 minutes of exercise outside per day to really make sure that you're moving, and then to have technology-free times. Never have your phone present at the dinner table, and also try not to have screens in the bedroom, as it also negatively impacts on your sleep, and it takes away of the quality time that you can spend with your family in terms of conversation, playing board games, telling stories, and really connecting.
Professor Renetta Schoeman, we're going to have to leave it there, but thank you so much indeed for your insights on this problem, psychological disorder that I think we really need to pay more and more attention to. And I'm going to shut my screen now and take a break. Thank you so much.
My pleasure. Good evening.
Thank you. All right, that's Professor Renetta Schoeman. And I guess it is a challenge of our times, isn't it, that we're facing the screens. It makes things in life simpler, but we really have to be careful not to spend too much time on it. Look out for the symptoms of ADHD and start to manage them. And if medication is required, your professionals will help. But by and large, take breaks. Talk to people rather than WhatsApp them. Now, the South Africa